It's common to experience anxious feelings or nervousness from time to time, especially over high pressure situations like a job interview or maybe a first date. Likewise, it's also normal for people to be sad or have bad days about certain situations for a temporary time. Having said that, I'd like for you to take a moment to think back to the last time you felt each of these feelings and try to hang on to both of those emotions for a moment. Now imagine feeling that way every single day for weeks, months, even years. If you've never experienced an anxiety disorder or clinical depression, I hope that small exercise gave you a bit of insight as to what life's like for someone who struggles with the illness. Firstly, I'd like to take a look at the medical definition of anxiety disorder and clinical depression. Anxiety disorders involve constant and unbearable feelings of excessive worry, paranoia, or panic, sometimes occurring simultaneously without any known cause. Though exact causes remain unclear, there are several factors that are said to be common in those who suffer from mental illness. Children, as well as young adults who have endured traumatic events or abuse, have a higher risk of developing anxiety disorder. Some medical conditions like hyperthyroidism, diabetes, and heart disease can be directly associated with anxiety problems. Alcohol and drug use can either provoke or worsen anxiety. Nevertheless, even certain personality types are more susceptible to mental illness than others. The physicians at the Mayo Clinic claim that although there are several specific types of anxiety disorders, such as agoraphobia and separation disorder, the most common in our society are generalized anxiety disorder and panic disorder. Having experienced the chronic chest pain, the trembling, dizziness, and shortness of breath, I know firsthand how scary panic attacks can be. It feels as if the walls are closing in, and no matter how much you tell your brain that everything's okay, the body reacts quite to the contrary. If panic attack does not subside after a few minutes, it could cause the victim to go into a state of hysteria, blackout, or even faint. Now that we've established an overview of what anxiety is, let's discuss the mental demon that so closely follows it. According to the physicians at the Mayo Clinic, depression is defined as, and I quote, a mental health disorder characterized by persistently depressed mood or loss of interest in activities causing significant impairment to life. Common characteristics of someone who is depressed is including but not limited to abnormal sleeping patterns, feelings of worthlessness, extreme fatigue, and unexplained physical pain. In most cases, if severe anxiety is left untreated, it is likely that the person will progress into a depressive state. Isolation seems to be the number one characteristic of someone who is clinically depressed. The article, What Causes Depression, by the Harvard medical students explains the in-depth brain chemistry behind clinical depression, but the primary reason is said to be the lack of the feel-good chemical in the brain, known as serotonin. The effects of anxiety and depression are very progressive and circumstantial from one person to the next. As we have established an understanding that anxiety and clinical depression go hand in hand, the risk and complications are nearly the same as well. Those suffering from depression and or anxiety may experience change in appetite resulting in substantial weight loss or gain. Often, both anxiety and depression disorders can lead to dangerous eating habits such as anorexia or bulimia. Starving oneself may provide a sense of accomplishment, whereas binge eating may provide comfort and temporary satisfaction. Unfortunately, some individuals turn to self-harm as a means of coping. The National Alliance on Mental Illness states that self-harm can be a result of excruciating pain and anger. And hurting oneself can psychologically make sense of the pain. Self-mutilation can also enable the person to feel in control, especially when he or she cannot control the compilations of emotions inside. Self-inflicted injury is not an appropriate means of coping. If you or someone you know struggles with it, then it is pertinent that the person seeks the proper therapy. Though anxiety and depression sound horrifying, there are options for treatment as well as preventative tactics. Medication prescribed by your doctor can be extremely beneficial when taken as directed. I can personally attest to medication alone, though, not being a cure, so to speak, but more of a band-aid that masks the underlying problem. Antidepressants and sedatives work most effectively when taken in combination with psychotherapy to rid of any negative feelings and to learn ways of coping with your disorder. There are various techniques to relax and maintain stress levels to help prevent relapsing with depression and keeping anxiety to a minimum. Doctors claim that participating in hobbies and activities that interest you, that interest the individual, can be very useful in enhancing mood. Physical exercise is also another proven tactic. Releases a lot of endorphins into the body, so it stabilizes your mood. I hope that I've provided a bit of an understanding how serious anxiety and clinical depression can be. And if you or someone you know battles either one or both mental disorders, please seek to help them find the appropriate treatment. It's not an issue to be embarrassed about, and it is definitely one with the proper treatment and determination that can be overcome.